Yes, go ahead.
Please play that slide, Dr. Shweta. Happy and delighted to welcome you all again for the third day of our PCOS certificate course from OIAH. I hope you all have been enjoying and are really having great interest in knowing more about how homeopathy can be helpful in treating the cases of PCOS. So today we are having our very good speaker, Dr. Shweta Singh. She is a BHMS and a MD homeopathic doctor, and she has been a core member of Orbit Clinic. She has been associated with Orbit Clinic since quite good number of years. From 2014, she has been a part of Orbit Clinic. And she is running a clinic in Nangal, Raya, which is in NCR, as a branch head of Orbit Clinic. She is also working as a senior research fellow in CCRH Homeopathy, having the headquarters in New Delhi. She is having great inclination and experience in teaching as well, because she has worked as an assistant professor in Department of Organon, because she has done MD in Organon. So she had been working as an assistant professor with a very reputed medical college. Right now, she is holding a post of DHMA, which is one of the mother concerns of Homeopathic Association, as a president post over there. Even she is a chief administrator of KHA Homeopathy Study Group, which is in USA. So having such a good experience, we will be very happy to have her session today. She'll be telling about the miasmatic and many other approaches, which will be very helpful for all of us in learning how we can proceed in treating the cases of PCOS through homeopathy. Over to you, Dr. Shweta.
Thank you, Dr. Shilpi. Shall I share my PPT?
Yes.
Yes, please.
Is it visible?
Yes, it's visible.
So, hello to everyone, and in the last 2 days, we have already discussed the anatomical, physiological, pathological aspects of the clinical condition, that is PCOD or PCOS, and that information will help you in making proper diagnosis of the cases, coming to you with the symptomatology like irregular menses, acne, hirsutism, etc. And diagnosis is definitely an important part, being a clinician, but being a homeopath, there is a lot more to explore in the diagnosed cases of PCOS. So we will be discussing about that, the in-depth understanding of PCOS or the patients with PCOS. Now, there is a difference between the homeopathic approach and the modern medicine. Homeopathic approach is always different from modern medicine. So we don't treat diseases, we treat a patient who is diseased. Am I right?
Yes, ma'am.
Yes. So today, 1 in 3 young girls are suffering from PCOS or PCOD, and the cyst in ovaries are the result of the hormonal imbalance. We have to restore the very system that is causing that imbalance of hormones. That is the mind, nervous system, nerves, immune system. Basically, the psycho-neuro-endocrine axis is disturbed. So the whole axis has to be treated, no? So thus, we need to know our patient wholly to treat this whole axis, the mind, the nerves which is affected, the immune system which is affected, and of course, the ovaries. Now, if we talk about the homeopathic case taking, which is a process of knowing our patient and his or her sickness in every respect, so that he or she can be treated in a rational way. Why do we do case taking or ask so many questions to our patient that seems to be interesting, strange, and unique to them? The answer is to individualize them. And what is individualization? It is, we basically try to differentiate every single case of PCOS from others by some exclusive features. As two individuals can't be same, the cause can be same, but the effect can be different. As we have vital force, which is one, but the manifestations are in many different ways. So what we call them the spectrum of symptoms. In aphorism 82, Dr. Hahnemann says that no real cure can take place without a strict particular treatment of each case of disease. So the definition of cure, what is cure? So it seems at first like it is just the disappearance of the symptoms. Disappearance of that irregular menses, it becomes regular, acne disappear. So, but it is much deeper from the point of view of organon. The changes made by the homeopathic simillimum directly goes to the core of the patient, the body on healing energy. It strengthens and the balancing of it. So not only the specific symptoms of PCOS will disappear, but the entire spiritual, mental, emotional, physical being is restored to the natural state. In aphorism 153, Dr. Hahnemann says, in search for a homeopathic specific remedy. The homeopathic specific remedy, we have no specific for diseases. In this aphorism, the homeopathic specific remedy is the remedy of the individual patient, the simillimum. So we need to carry out an in-depth study of and individualize our patient with the help of perceptible signs and symptoms. What we have to find out? We have all the general symptoms. The more general and undefined symptoms demand least attention when of that of vague and indefinite character. Every PCOS case comes with the symptom of irregular menses, or acne, or hirsutism, obesity. These are the general symptoms, as they are present in every disease and every drug. What do we need to find out? We need to find out the more striking, singular, uncommon, peculiar, characteristic signs and symptoms of the case, which are chiefly and most solely to be kept in view. So every curable case has these striking, uncommon, peculiar, characteristic signs and symptoms. But they are hidden in the details of the case and symptoms of the case. So we homeopath must possess such skills to dig them out. From where we have to dig? We have to go into the past history, the history of presenting complaints. We have to ask the physical generals, mental generals, particulars. So that's why case taking requires skill and art of the physician. It is not a mechanical process. We need to dig out these symptoms from our patients. So let us discuss how to approach a PCOS case, how to treat our patient who is coming with the complaints of irregular menses and the investigation, saying, diagnosing that she has PCOS. As we treat our patient as a whole, we need the complete picture of the disease patient, which our master discussed in aphorism 6, the portrait of disease. So how will you form the complete sketch of the patient, the diseased patient, and how will we gather all the information related to the patient and her disease? We need to collect the data from our patient, the feelings of the patient, what our patient is feeling, what are her presenting complaints. Along with that, we have to inquire the attendants, the family members, the friends of the patient. We need to rely upon the laboratory investigations, upon the USG, TVS, or MRI, or the hormonal tests and all, LH, FSH, what we have discussed in yesterday's class. So we have to rely upon that for the diagnosis, and definitely the physician observations, our observations. Whenever the patient enter into your clinic, in the waiting area, you have to observe. When he enters into your chamber, you have to observe the gestures, the behavior of the patient to other patients, to you, yourself. You have to observe everything since the patient is entering your clinic. Then you have to interpret it. You have to interpret the information gathered from all these sources. Now, the cause of PCOS. In the yesterday's class, Dr. Manisha told about many causes and risk factors of PCOS, like hereditary factors, stress, sedentary lifestyle, hormonal disbalance, imbalance, etc. But Dr. Henneman, in his Organon of Medicine, in aphorism 5, he discussed about the fundamental causes of chronic disease, which is the only cause of which is only responsible for the chronic diseases, that is miasm, psora, syphilis, and psychosis. In aphorism 78, Dr. Henneman discussed that true natural chronic diseases owe their origin to chronic miasm, constantly extending and without carefully regulating mental and bodily functions. They will never tend to cease the suffering till the end of his life. Chronic diseases, according to Dr. Henneman, are produced due to these three basic miasmatic constitutional disturbances, or the chronic miasm. The chronic miasm giving rise to all forms of chronic diseases are psora, syphilis, and psychosis. Further, he mentioned about the chronic latent state of psoric, which can be awakened by the incidents and life circumstances like excessive hardships, injuries, wounds, excess of cold, heat, unsatisfied hunger, poverty, lack of open air. There are many factors that can awaken that latent state of psora, and psora is present in everybody, but in the latent state until and unless there is some exciting factor or incident that arouse it. So the much more injurious and triggering the latent chronic state to the outbreak of chronic disease manifestations are emotional disturbances. These are the most injurious triggers that arouse the latent state of psora or the miasms. Incidents in female life like unhappy marriage, remorseful conscience, change of this fortune, there's any guilt of past actions or events, sudden death of son, melancholy from the disappointment in love. So these are the factors that can excite the disease condition, that PCOS condition, at first at the functional state, and later on it can go deeper, and there can be structural changes like we have discussed, cyst in the ovaries, formation of cysts. So the incidence is due to the life circumstances of the patient, And the chronic state is due to the patient's constitutional predisposition. Like there is obesity, there is hereditary PCOS is there. So she is already predisposed to such condition, development of such conditions, and the inherited pathological miasmatic tendencies. Now, if we talk about the female case taking, then in aphorism 94 footnote, Dr. Hahnemann stated that in chronic disease of females, it is especially necessary to pay attention to the pregnancy, to sterility, the sexual desires, accouchements, miscarriages, suckling, state of menstrual discharges. With respect to the last named particularly should not be neglected to ascertain. So in the menstrual history is very important if any female is coming to you, and we have to ask about the menstrual flow, if it recurs at 2 short intervals or if it is delayed, it is beyond the proper time, how many days, the duration, how many days it lasts, whether its flow is continuous or interrupted. It comes, then it stops, and then it again reappears. So there is interrupted flow, intermittent flow. What is its general quality? What is the color? How dark its color? Whether the leukorrhea before its appearance or after its termination. So leukorrhea before or after menses, but especially the bodily or mental ailments. So along with the menstrual discharge, what are the associated complaints? Physical or it can be mental. What sensation and pains? We can ask about the dysmenorrhea if she is having, or back pain or pain in any area which is associated with menses. Headache, what sensation and pains it is preceded, accompanied or followed. So we have to ask the complaints appearing before, during and after menses. That is important in the case of female. If there is leukorrhea, what is its nature, what sensation attends its flow, in what quantity it is, and what are the condition and occasion under which it occurs. So we have to take note of the symptoms accompanied with leukorrhea. So in the menstrual history, we have to ask what is the menarche, what is the last menstrual period, what is the cycle, duration of the period, character of menstrual flow, right? Quantity, its color, its order, associated complaints, that is before, during and after menses. It will help you in differentiating your patient. How? We will discuss it later when we discuss about the miasm, right? It helps you in the miasmatic diagnosis. It will help you in differentiating your remedies and to reach towards your remedy or the similar. Associated complaints, physical complaints, like physical complaints, any desires that is accompanying during the menses, any aversions, any nausea, pain in leukorrhea, dysmenorrhea, what kind of dysmenorrhea is there, mental ailments, if there is any exhaustion, very extreme exhaustion during the menses. So you can differentiate your remedy according to that. That is exhausting menses are there in illumina, ecoculus, semicifuga. Like if there is incremental ailments, if there is increase of mental symptoms during the menses, you can think of semicifuga. If there is diarrhea before menses and during menses, it can be bovista, it can be ammonium carb. Constipation is there, then it can be cilicia. So if you are asking about the flow, so when did it occur? So if flow only when lying down, so it can be creosote, mac carbs. So in this way, you can differentiate your remedies with these symptoms, with this in-depth understanding, in-depth questioning, of the symptoms, you can get your remedy. Vaginal discharge, if it is before or after menses, how many days after menses. We have remedies in which it is mentioned 10 days after menses, right? So what is the quantity? If it is profuse, if it is profuse like water, if it is going down to the heels, we have alumina. So we have different lot of remedies which we can differentiate with our questionings, with our case taking. The character of discharge, if it is yellow in color, if it is white in color, if it is bluish in color, we can differentiate our remedy. The character of discharge, if it is thick, if it is thin. So with this information, we will be able to differentiate our remedy. Then the type of sensation attended, leukorrhea, if there is leukorrhea, if there is back pain with the leukorrhea, if there is increased perspiration with the leukorrhea. The modalities are important. If it is more during when she walks, if it is more when she lie down. So these we have to ask our patient. Then complete symptom of pain. So PCOS patient can be complaining of the dysmenorrhea. So we can ask the time when it occurs, the location of pain. It can be left-sided, it can be right-sided, it can cover the whole abdomen. So we can differentiate our remedy with the location. We have to ask the sensation, how's the pain, if it is pricking, if it is stinging, if it is burning. We have a lot of sensation mentioned in our repertory and in our medicines. Modalities, if it is better by warmth, if it is better by bending forward, better by cold. So we can differentiate our remedy like this, and we have to find out the probable cause of the pain. If anything is there, then the emotional reaction during the pain, during the menses, the emotional reaction during the pain, the emotional state of the patient. Now the selection of similimum. The main basis of selection of remedy, both in acute and chronic diseases, is the totality of the symptoms. So we have to make a totality of the symptoms. The totality of the symptoms in a chronic state is different totality. So the totality of symptoms that suggests the remedy in acute cases does not suggest the remedy in chronic one. The totality of acute is different from the chronic case. From the record of chronic case, you have to judge out what miasm is there, or if there is two miasm present. And after ascertaining that, you have to select an anti-miasmatic remedy. So this is the difference in acute and chronic totality, that the medicine has to be anti-miasmatic, while in acute it need not to be. So but in the chronic case, you have to select anti-miasmatic. You have to find out what miasm is present. Now we have already discussed the totality of the symptoms, how it will be formed. Like we have to ask the patient about the mental generals. We have to ask the patient the emotional state of the patient. We have to how her behavior is, what is the emotional state, how is her intellectual state, how's her memory. We have to ask the mental symptoms. Along with that, we have to ask the physical generals of the patient. Physical symptoms, like we have to ask about the appetite, how is the appetite, and we have to ask the open-ended questions. How's the appetite? How she is feeling after eating? We should avoid the leading questions or the direct questions. How's the thirst? Right? what kind of water she likes, what are the desires, what kind of food or drink she likes, what she craves, the character of stool, the sweat, how is the perspiration, what is the order, what is the location, because we have medicines like if the order is like smell like honey, it can be thuja. If it is smell like onion, it can be bovista. If the perspiration is more on head, we can think of calcarea group. If it is on the uncovered parts, we can think of thuja silicea. So with these physical generals, appetite, thirst, desires, aversion, stool, urine, perspiration, we can differentiate our remedy. The sleep, the posture of sleep, the position of sleep. If the patient likes to lie down on the back or on the belly, what is the position? So we can differentiate with these symptoms. Then the dreams. Then the particular symptoms. Particular symptoms alone can enable us to picture the particular case in our mind and helps us in the selection of the simillimum. So when it corresponds to the general symptoms. So they are very important when it corresponds to the general symptoms. So particular we cannot neglect. Then the miasmatic concept, if we talk about PCOS, it is a common endocrinopathy where there is oligo-ovulation or anovulation. There is signs of androgen excess, and there is multiple small ovarian cysts. So in case of PCOS, it is the psoric miasm, because at first there are irregular menses which happen. There is initially functional changes. Then it is followed by involvement of psychotic miasm, which leads to cystic changes in the ovaries. So PCOS is a result of combination of psoric and psychotic miasm in the sick individual, which through neurohormones pathway leads to imbalance of hormones and formation of cyst. And if syphilitic miasm also unites with both of them, it leads to various malignant processes and ultimately to cancer pathology, which is rare. Now,
I'm sorry to interrupt, Dr. Shweta. There are two questions. Can you please see to that?
yes, yes, ma'am.
You can see in the chat box the questions.
Dr. Akansha, yes, PCOS come under chronic disease and PCOD under acute disease. No, PCOD is not acute, it is also chronic. Both are chronic. But in PCOD, there is irregular menses, and we have already discussed the diagnosis, how to form the diagnosis. There is the changes in the ovaries. Then we can say that it is PCOD, right? When it is not involving other organs or systems of the body, when it is only incorporated in ovaries, then it is PCOD, and when it involved other systems, it is PCOS. So it is getting deep into the system. So both are chronic disease. Ma'am, how to manage, Dr. Priyanka, how to manage acute manifestations if come in the treatment of chronic disease? We will discuss it later. I'll answer that. Is it, Dr. Mohammed, is it manageable or palliative or curable in advanced cases of PCOS? Sir, what do you mean by advanced cases of PCOS?
I think he means about that there is a very long period of PCOS and patient is not having very regular medicine regular medicine after even the treatment of many years and also presenting with the chronic complaints or the chronic complications. I think he want to say that.
Sir, if our case is, we can manage the case, we can cure. The cure is only possible when whole of the, cure as, if her menses is regular, then we can say that is cure, but mentally the patient is not feeling good, right? So I have already discussed what is the definition of cure. Like if there is disappearance, we can manage it with the disappearance of symptoms. But if it is very complicated and the patient is not recovering mentally and other symptoms, he has diabetes or other symptoms are also involving, then we don't have, or if it is she is taking a lot of allopathic medications. The cases are artificially chronic diseases and they are very difficult to manage. In that cases, we have to palliate. When other systems are also involved and they are taking it for a long time and we cannot ask them to stop those medication, we cannot cure. In that cases, we have to palliate. Right? Any other question?
I think you can go ahead, Dr. Shweta.
Now, SORA is basically deficiency and psychosis is excess. And the seat is nervous system, ectodermal tissues, nervous system, blood vessels, liver, skin. A psychosis, there is involvement of endodermal tissues, soft tissues, attacks internal organs, pelvis, and sexual organs. These are the prominent seat of psychosis miasm. And in SORA, there is deficiency disorders. We have seen amenorrhea, and in psychosis, there is deposition or cyst formations are more in psychotic state. SORA is functional disorders manifested by hypersensitivity, itching, irritation, burning, leading to congestion, inflammation with minimal structure changes. In coordination, in psychosis, there is overproduction, androgen excess is there, growth is there, infiltration, cysts, all is there. SORA is basically hyperactive and psychosis is extremely slow. So, from this slide, the question of Dr. Akansha is clear. PCOS, PCOD, there is functional disorders. So it is SORA. SORA is also, chronic state, chronic miasm, and psychosis. If it is in later stages, cyst formation, it is also psychosis. So both are chronic states.
Okay, ma'am.
Then in SORA, the menses are, there is amenorrhea, functional disturbances of ovaries and uterus. There is irregularities in menses. Menses can be too copious, scanty, it can be early, it can be late, or it can be of long duration. It can be watery, connected with various bodily ailments. Menses are slow in setting in after 15th year and later on. After appearing one or two more times, they cease for several months. So in many girls, we have seen that in puberty, they have menses, then it stopped for several months and or for years. So the flow in SORA, it can be only for one day, for few hours. There is scanty flow, imperfectly small quantity. It can be intermittent. The menses flow are usually bland, watery, blood or brown. Sorry, clots basically, if you ask about the clots from the patient, so sorry, clots are small, while the psychotic clots are large. In psychosis, pelvic organs, I have already told that it is often the seat of psychotic troubles, the pelvic organs in women, and menses are abundant in psychotic state. Flow often only with pain. So there is pain in psychosis. The flow is offensive, stringy, large clots is there. It can be black or excoriating, burning and biting in the pudendum. The stain of menstrual blood in psychotic trait is difficult to wash off. So we can differentiate what miasm is there when we ask the patient about the staining, about the color, about the menstrual, when we are taking the menstrual history about the dysmenorrhea also. So there is inflammation of ovaries, fallopian tubes, and inflammatory disease, which can be traced to psychotic taint. And in more chronic problems, cystic degeneration of ovaries, uterus, and fallopian tubes are there. If we talk about the leukorrhea, when we differentiate, so in SORA, leukorrhea is basically bland, starchy, watery. It can be scanty. It is not exhausting, may be of any color. There is excessive sexual desires there is in SORA. In psychosis, leukorrhea is scanty. It is acrid and it is very much offensive, like fish brine odor. It is greenish yellow in color in psychosis. And the patient has to douche frequently. It produces excoriation, little vesicles on the pudendum, and it is very, and it annoyed the patient very much. So in SORA, it doesn't cause any like mental harm to the patient, but in psychosis, the patient is very annoyed. And there is mental weakness during leukorrhea in psychosis trait, psychotic trait. There is itching of pudenda, pruritus vulva will be there in psychosis, polyuria during menses, mastodenia. So this all happen in psychotic state. In SORA, dysmenorrhea shows itself early at the puberty, or it can be at the climacteric period. There is infertility from the lack of sexual desire, either frequent or constant, without any organic defect in the sexual parts. In psychosis, the dysmenorrhea is spasmodic, colicky, and paroxysmal. Infertility is basically because of the various factors like hormonal imbalance, from the pelvic inflammatory diseases, or other conditions like endometriosis. If we talk about the skin, so PCOS or PCOD patient came with the acne. So how will we differentiate from the presentation of their acne? So in SORA, the skin is very dirty looking. It is very rough, dry, harsh skin is there. It look like as if it is unwashed. So more you bathe, the rougher it becomes. So it cannot endure water. There can be pimples, herpes, crust, small round red spots on the skin. Eruptions are papular with intense itching in SORA. They are of skin color unless inflammation is present. There can be recurrent small boils can be there. SORA has no smooth, clear skin. There is always roughness, the dirtiness is there. There's the acne is always accompanied with unbearable itching, burning. There is very little separation. They are apt to be dry, seropurulent. Occasionally they can be bloody. So in SORA, there is tendency of recurring skin diseases, sensation of burning, and scaly eruptions. But in psychosis, the acne are very large. They're red. They're angry looking, and blunt papules appearing about the menstrual period. So near to the menstrual period, these acne appear, which are very red, large, and angry looking. They do not suppurate. They're very sore and sensitive to touch. They are very separated and isolated from each other, and there is unnatural thickening of the skin. Irregular, thick, pale, rigid nails will be there. There can be warts, red moles, psychosis. We already know that warts are there, verruca is there. Hyperpigmentation can be there. We have read about insulin resistance in the yesterday class, acanthosis nigricans. So there can be hyperpigmentation, there can be depigmentation. There is this skin of psychotic patient is oily skin with thickly oozing copious perspiration, which represents psychosis. Now, mind, we talk about the mind. The Sora is hyperactive. She is very hypersensitive, quickly fatigue, will desire to lying down, weakness of memory. There is fear, which is manifested by anxiety. They're indolent, dishonesty. In weakness and inferiority complex, it limits expression of thoughts. They are self-centered, selfish, inability to concentrate, cannot tolerate noise and crowded places. And in psychosis, they are very quarrelsome, they are very rude, they have fixed ideas and manias. The tendency is there to harm others. They're very secretive, they have suicidal thoughts, they are absent-minded, they're very suspicious, jealous, mischievous, narrow-minded, and anger aggravated by change of weather and from thunderstorm. If we talk about the desires, so the desires are basically very important in our case taking, as they are the basic miasmatic symptoms. They are next to the mental state in disease. We do not need to work on the individual symptoms and remove them, but to hit the core of the disease. So we have to take note of these diseases, these general symptoms, which can differentiate our remedy. One by one, the group of these symptoms will make the totality, and then only we can select a simillimum or according to the miasm. So in Sora, the desires are sweet, sour, fatty food, fried, indigestible things, spicy, oily, and hot food. While in psychosis, the desire for alcohol, table salt, coconut, fat, meat, well-seasoned food, peppers, pungent, and salty foods. Aversion is from milk, boiled foods, and cold foods in Sora. While in psychosis, they have aversion to meat, milk, wine, and spices. Now the modalities, which plays an important role in the selection of our remedy. So in Sora, the aggravation is from in winters, while in psychosis, the aggravation is from damp weather or rainy weather, humid atmosphere, thunderstorm. This aggravates psychosis. In Sora, standing aggravates warmth. The psoric patient wants warmth, and the change of weather aggravates psychosis. Rest aggravates psychosis. Amelioration is in Sora, aggravation is from sunrise to sunset, while in psychosis, the aggravation is from sunset to sunrise. Amelioration is from summer and heat, warmth in Sora. Scratching ameliorates, crying, eating ameliorates in Sora. They are better by natural discharges like urine, sweat, menstruation, etc. So any patient that is having any mentally, emotionally unstable, or having many symptoms like PCOS, if they are not having their menses, they are very much anxious, they are very much fearful, they have many complaints like they feel themselves they are very much, they are gaining weight, and they look very anxious regarding all these symptoms. So whenever they get the flow, they feel better. So they are better by natural discharges, that is Sora, urine, sweat, or menstruation, etc. And the appearance of suppressed skin eruptions, that also ameliorates. In psychosis, the dry weather, lying on stomach or with pressure, it ameliorates. Motion ameliorates, or stretching ameliorates. They are ameliorated by unnatural elimination through mucous membrane surfaces like leucorrhea. They are better by nasal discharges, right? Or the return of the suppressed normal discharges like menses. Any question?
Yes, we know, Dr. Shweta, organon is a subject where we need a more concentration, but still you are presenting in a very simple way, and I think you should continue. If we have any questions, then we will let you know.
Sure, Singh,
Please
thank you.
continue.
Okay, now we talk about syphilis. It is very rare, but because PCOS is a SORA psychotic disease, but if somehow syphilis is involved, then the menses can be profuse, which is acrid, it is offensive, it has a odor of metal and irregular periods in both quantity and frequency. So कभी ज्यादा हो जाएंगे, नेक्स्ट पीरियड स्कैंटी हो जाएगा, फ्रीक्वेंसी भी कभी अपीयर हो जाएंगे, देन स्टॉप हो गया, इंटरमिटेंट, इट कैन बी इंटरमिटेंट फ्रीक्वेंसी, कभी आपके 3 दिन हो गए, कभी 2 दिन हो गए. सो इस तरह से देयर इज इरेगुलरिटी इन द menstruation. The pain are basically characterized by bone pains, and there can be backache in syphilis, and discharges are always acrid, putrid, and offensive. Skin, there is hard acne on the face, there is depigmentation of skin. Infertility, the possible failure to discharge the ovum at ovulation resulting in infertility. And the general manifestations, we all know there is destruction in the syphilitic miasm. There are deformities and fragility. Now there can be tubercular miasm, and symptoms basically in tubercular miasm is associated with bleeding disorders. Menses can be exhaustive, they are prolonged, they are copious. Menses every 2 weeks, profuse bright red color in color, lot of clots are there. Patient feel poorly a week before menstruation starts. Flow can also be pale but long lasting, often resulting in anemia because of so long copious prolonged menses. So pain may not be painful but always exhaustive, right? That is in syphilis. This flow is watery, long lasting, and rarely offensive. Profuse and blood tinged or hemorrhagic can be associated with clots. Face, there is blotted appearance of face, especially after sleep. Infertility is resulting from the prolonged menstrual bleeding, and there are dystrophy with hemorrhage, there is dissatisfaction, depletion is there, and patient craves the things which make them sick. So this is all about the miasm, and unless your prescription is miasmatic, there cannot possibly be a cure. So it is the only approach which enables us to understand the grouping into a common entity of distinct phenomena, which can even sometimes alternate with one another. That quote is from Thomas P. Pichero. So after you ascertain the miasm or one miasm or the miasms, the complex, from the symptoms available in your record, deal out your first stroke to the miasm that is predominant at that time. The fact is, even if there be all the 3 miasm apparently present, only one of them is predominant at a time. So you have to find out that predominant miasm at that time. So the miasm that is torturing your patient the most must draw your attention first. The reason why only one miasm is predominant at a time while the other are comparatively dormant is the operation of the immediate exciting cause, which is responsible for exciting the manifestations. So you must select the remedy indicated by the symptoms of the predominant miasm and not by the totality of symptoms of the whole case. Are you getting my point about the predominant miasm?
No, ma'am. Please explain it again.
Yes. So basically, अगर आपके पास PCOS का पेशेंट आया, और लेट मी गिव यू वन स्मॉल एग्जांपल, लाइक आपके पास एक पेशेंट है जिसको इचिंग इरप्शंस है, राइट? यू आर टेकिंग दैट केस कि आपको इचिंग इरप्शंस है और कोई सिम्टम्स एज सच आपको नहीं मिल रहे हैं. बट अनदर टाइम जब पेशेंट आपके पास आया, देन उसने बोला कि जब भी बारिश होती है, when there is rainy season, या जब भी बारिश होती है तो जो उसके इचिंग इरप्शंस हैं वो इंक्रीज हो जाते हैं. जब भी बारिश होगी तो उसको उसी टाइम पर वो इरप्शंस आएंगे, राइट? तो टोटलिटी में जो आप लोगे प्रीडोमिनेंट माइजम, यहां पर क्या हुआ? इचिंग इरप्शंस हैं, बारिश होगी तो इंक्रीज हो जाएंगे. सो द मोडालिटी इज ह्यूमिड वेदर, जब भी बारिश हो रही है तभी, एंड विच इज वेरी परमानेंट सिम्टम. ये जो रिकरेंसी है, आप सिम्टम्स, मैंने बताया कि एक्यूट की टोटलिटी अलग होती है एंड क्रॉनिक की टोटलिटी अलग होती है. क्रॉनिक में आप हमेशा वो सिम्टम्स लेंगे जो कि परमानेंट है, चेंजेबिलिटी नहीं है वहां.
ओके.
राइट? तो जब भी बारिश हो रही है तब उसके जो सिम्टम्स हैं वो आ रहे हैं. तो मेन सिम्टम इज द रेनी वेदर. वहां पे माइजम इज साइकोसिस एंड रेमेडी कैन बी डलकमा, विच इज कवरिंग द साइकोटिक माइजम. वहां पे फिर आप जो बाकी के सिम्टम्स हैं जो कि कभी आ रहे हैं कभी नहीं आ रहे, वो आप कंसीडर नहीं करेंगे. तो जब आप टोटलिटी बनाएंगे और जब आप डिवाइड करेंगे अपने सिम्टम्स को इन द माइजम कि ये सो रहा है, ये सिफिलिस है, ये साइकोटिक सिम्टम है, अभी के प्रेजेंट स्टेट में क्या प्रेजेंट है. एंड एक क्वेश्चन था एक्यूट अगर बीच में आ रहा है, आप क्रॉनिक केस ट्रीट कर रहे हैं और बीच में एक एक्यूट सिम्टम्स आपके पास आ रहे हैं, तो आप क्या करेंगे? सो बिफोर गिविंग दैट एंटीमाज्मेटिक रेमेडी जो कि परमानेंट सिम्टम्स पर होगी, जो सिम्टम्स परसिस्ट कर रहे हैं, जो हमेशा से है, जब से पेशेंट को प्रॉब्लम स्टार्ट हुई है तब से वो पेशेंट ये सिम्टम रिकरेंट है, तो हमें वो परसिस्टेंट, वो परमानेंट है कि नहीं वो देखना बहुत जरूरी है. तभी हम उनके बेसिस पर ही हम एंटीमाज्मेटिक रेमेडी फॉर द प्रेजेंट स्टेट हम सेलेक्ट करेंगे, राइट? एक्यूट अगर आ रहा है एंड बिफोर गिविंग योर एंटीमाज्मेटिक ट्रीटमेंट, अगर कोई एक्यूट कंडीशन है, सो यू हैव टू ट्रीट दैट एक्यूट कंडीशन फर्स्ट with the remedy which those symptoms are calling.
ओके मैम.
राइट? तो पहले एक्यूट भी कभी भी आप क्रॉनिक केस के साथ मिक्स नहीं करेंगे. यू विल ट्रीट द एक्यूट फर्स्ट. आफ्टर दैट यू कैन, जब वो स्टेबल हो जाए, वो एक्यूट ठीक हो जाए, जब पेशेंट उस एक्यूट से रिकवर कर जाए, देन ओनली यू हैव टू गो फॉर दैट एंटीमाज्मेटिक रेमेडी. राइट?
राइट मैम.
डॉक्टर प्रियंका, आपका क्वेश्चन आपका क्लियर है?
मैम बट एक्यूट मेडिसिन एंड क्रॉनिक, जो क्रॉनिक मेडिसिन है, एंटीमाज्मेटिक मेडिसिन है, वो बहुत साथ में नहीं चल सकती हैं इंटरवल में?
नहीं, जो भी क्रॉनिक मेडिसिन है वो आपकी साथ में नहीं चल सकती है. एंटीमाज्मेटिक ट्रीटमेंट आप तभी देंगे जब उस टाइम पर कोई एक्यूट से पेशेंट परेशान नहीं होना चाहिए.
ओके.
थैंक यू वेरी मच.
ठीक है, पहले आप एक्यूट ट्रीट करेंगे. अगर उसको डिस्मेनोरिया है उस टाइम पर जब पेशेंट आपके पास आया है, या उसको बहुत ज्यादा प्रोफ्यूज मेंसेस हो रहे हैं, बिकॉज उसको बहुत महीनों से मेंसेस एमेनोरिया था, उसको मेंसेस नहीं हो रहे थे, एंड अब पेशेंट आपके पास आया है, उसको प्रोफ्यूज मेंसेस हो रहे हैं, तो यू हैव टू मैनेज दैट एट दैट पॉइंट. So you have to give that acute remedy or the remedy on the basis of those symptoms which are present at that time. So you have to manage that accordingly. And after, when the patient is stable, उसके बाद आप पूरी हिस्ट्री लेंगे और उसके बेसिस पे जो भी आपकी एंटीमियास्मेटिक रेमेडी है, क्रॉनिक जो भी रेमेडी है, वो आप उनको प्रिस्क्राइब करेंगे. Am I clear?
Clear, ma'am.
Yes, ma'am. One more question, ma'am. If a patient purely on homeopathic medicine, no allopathic intervention, so is there any possibility that without allopathic intervention, homeopathy can cure all the chronic issues also if the patient is suffering?
Yes, sir. It is possible. Depending
Yeah.
upon the pathology, if it is getting worse and if it is a very complicated case, according to pathological structural changes, it depends on that.
But no allopathic intervention, even a single,
Right,
you can
but
say.
If there is no
So
allopathic intervention is there, but if the case is very much complicated and the structural changes are out of the limit,
Okay.
then
Okay, possibility there is, because
then we
what I
have to
understood is
pay.
that chemical drugs, that is the most causing harm, like whatever you can say regarding treating PCODs, people they are on chemical medicines. So if it is purely homeopathic, the patient, so can it be possible in future that have less recurrence of PCOD symptom if only on homeopathy medicine?
Sir, it depends on if we are treating it with the anti-miasmatic remedy, and there is no such exciting causes there. She has to maintain the lifestyle.
Yeah.
So
There
everything.
is a hope that in homeopathy can address these issues without.
Homeopathy can cure such cases with no after effects, and there
Very
is.
good. Thank you very much.
Yes, thank you.
I would assure, because this is PCOD is out of my subject, so I took intentionally just to know about at least treating. You people can treat all of this, but at least I want to know. People, globally, they want to know that homeopathy has a role if a patient is not on chemicals, because many people they are suffering a lot. So for that reason, I took the course just to understand what exactly going on.
Yes, definitely.
Thank you very
it can
much.
Regularize the menses, and obviously it treats the patient as a whole. So the result will be consistent.
Yeah, thank you very much.
Permanent. Yes, thank you. So the classical principle prescription is based on the totality, the miasmatic totality. It will cover the totality of the symptom, the group of symptoms. Those are characteristic, peculiar about the patient. The essence can be, you should include the gestures, you can include the postures, behavior of the patient according to your observation. You can take the keynotes, which should encompass PQRS symptoms of the case. Then only you can make a classical prescription. Sir, how much time is left? Do we have any more questions?
I think there is one question which Dr. Priyanka, I think, has put. You can just see in the chat box that what's the right time of administration of homeopathic medicines? Is it in the morning or is it in the night? That's what she wanted to ask.
You got the question, Shweta?
Yes, sir, please.
The question is, ma'am, what time is beneficial to give homeopathic medicines, in the morning or at night?
The best time to give your anti-miasmatic medicine in the morning, empty stomach, not at the bedtime or before 1 hour of sleep before going to bed, and it should always be in the morning and on empty stomach, because the sleep can delay the beginning or the action of the curative action of the medicine. So it should be given in the morning. Also, it will help you to avoid the homeopathic aggravation or any aggravation from the remedy at the night time. You all know that if the remedy is correct, there is slight aggravation of the condition of the patient, and it depends, the aggravation is also depends upon the potency selection. So to avoid those circumstances, those effects, that aggravation period, so you should give the remedy in the morning, so that if there is some aggravation or something, you can manage that in the daytime.
So, and the next question is from Dr. Abhishek. What are the points for confirmation to tell a case of PCOS having psychotic nerve?
I have already discussed all this major of the symptoms of psychotic trait. So when the patient is coming with these types of symptoms, you can say that it needs a psychotic, antipsychotic remedy.
Okay. And Dr. Abhishek is also want to know about when to give homeopathic medicine in a female after the flow has stopped or during the flow.
When to give homeopathic medicine in a female after the flow has stopped or during the flow. Okay, great. So administration of homeopathic medicines in females, I'll continue this one. So anti-psoriatic medicine or anti-miasmatic treatment should not be given before the menses are expected, or shortly before the menses are expected, or during the flow. It should be avoided. The medicines to be given is 4 days or 96 hours after the menses have settled. So during menses, you should avoid giving this anti-miasmatic treatment. You should give it after 4 days from the first day of your menses, right? 4th day of your menses, you can give that remedy. Any other question?
Yes, I have a doubt. If a patient is coming with a more bleeding and the bleeding is continue for 4 to 5 days, and
Yes.
the remedy comes is the phosphorus, then what should we do? Shall we give the phosphorus at that time, or
You should give the acute remedy at that time, not the deeply acting remedy.
but the remedy is coming the phosphorus.
If the remedy is coming as a if that patient's remedy is phosphorus, and if it's the anti-miasmatic remedy, if it is the constitutional prescribing, you should avoid giving that at the time of her menstruation or at the time of that acute problem, right? You should give it after the menses.
Okay.
Because it is clearly written in chronic diseases that the antipsorics or the anti-miasmatic treatment has to be given after 96 hours, not during the flow. So if it is profuse, then I have one more thing for you. Then if there is morbid state of menses, so in the case the menses previously has been premature, or if it is too profuse or too long lasting, it is often necessary to give on this 4th day a small dose of Nux vomica, one very small pellet moistened with high dynamization or to be smell. आप दे सकते हैं स्मॉल डोज, एक छोटा सा ग्लोब्यूल, या फिर आप उसको सिर्फ स्मेल करा दीजिए ड्यूरिंग टू गिव ऑन दिस 4th डे आप उसको देंगे. ठीक है, आप वो फॉस्फोरस नहीं देंगे, पहले आप उसको नक्स वोमिका देंगे लाइक दिस और स्मेल कराएंगे, एंड ऑन 4th और 6th डे फॉलोइंग दैट you will give that remedy, the antisoric or anti-miasmatic remedy. Or if the female is very sensitive and nervous, she ought, until she comes near her full restoration, to smell such a pellet once about 72 hours after the beginning of her menses, notwithstanding her continued antisoric treatment. Now, why Nux vomica as an intercurrent? Because this will order the disharmony arising in the functions of nerves from so disorderly a flow of menses. जो profuse menses हो रहे हैं उसकी वजह से जो disharmony आई है nerve functioning में, इसको वो correct कर देगी, and it will also quiet the excessive sensitiveness and irritability which put an insurmountable obstacle in the way of curative action of the anti-psoriatic remedies. So Nux vomica will be a better choice before giving the anti-psoriatic remedy. So thank you. Any more questions?
Yes, Dr. Akansha Chauhan is want to know, but ma'am, some psychotic medicine given in night.
Which one?
Dr. Akansha Chauhan, which remedy you want to give in night?
Where it is, can you please give me the reference where it is written that Thuja has to be given at night or at bedtime?
So, Dr. Akansha, do you have any reference?
Because whatever I have written in this PPT of mine, it is purely from the chronic disease written by Dr. Henneman, and he wrote all these thing, when to prescribe, when to administer anti-psoriatic remedies or anti-miasmatic remedies. So if you have any reference, I'll update myself.
So I think, dear student, what we are doing, that we are catching up the textbook of our medical sciences. We are giving you the essence of these textbooks. So we are not modifying the homeopathy. So we are just keeping our principles, and we are here to describe you the actual principles of homeopathy. So do not modify homeopathy your own way, or do not learn the homeopathy from the others' theories. So we are here to give you the perfect essence of the homeopathy, and we are trying to give our best. So Dr. Shweta, this is wonderful session, and I think Dr. Shilpi, if you permit, I will show a little aphorism to everyone, which is very necessary to understand.
So there's
In,
one more question from Dr. Sakshi Garg. Can we take that before you proceed? So shall I take the question?
yes, yes.
Yes.
Can you use
So
next one if patient is having menses for 25 to 30 days?
yes, we can use Nux vomica. We can ask the patient to smell Nux vomica, but after that you have to give that anti-psoriatic remedy for sure to stop that recurrency of profuse menses or anything like that.
Great. But here is the question: if the patient is coming with the bleeding per vagina for 25 to 30 days, you should stop this medicine, this bleeding, because the patient will go under the shock or the anemic shock. So we should consider the acute remedies which can easily stop the menses, and you should
Yes.
know the cause. You should know the cause. If it is from the fibroid of uterus or any other pathology, then you should take emergency care or the emergency medicines.
Yes, we have many anti-hemorrhagic remedies. So for that time, if she is bleeding for 25 or 30 days, it can lead to anemia, it can lead to many complications. So you have to treat it, manage it at that time with acute remedies, anti-hemorrhagic remedies you can choose according to the symptoms of that patient. For the that Nux vomica is for before giving that anti-miasmatic remedy, not to handle or to manage or any other complaint which is very severe. If there is a severe dysmenorrhea at the time of menses, you have to manage it with the acute remedy.
Okay, so Thank you, Dr. Shweta. Dr. Shilpi, can I show one slide if you permit?
Yes, sure, sure. Please go ahead.
Dr. Shweta, can you stop your share?
Yes.
screen? Now, here is my favorite approach. Dear student, do you know the meaning of that symbol we are having into our organ? Except my student, anyone want to share about this symbol? What actually this represents? So what I am explaining about the third aphorism. You just read the bold lines, and the first letter is if. So Dr. Samuel Hahnemann was very perfect scientist and a perfect physician who know everything, and he gives a condition and wrote the first word if. If the physician clearly perceives, meaning if the Dr. Manisha or Dr. Shweta or Dr. Shilpi or either me, I'm not having my concentration to observe my patient, and I am having mind here and there, I'm going to the movie, and my patient is in front of me. So we are not clearly, if we are not clearly perceive the patient, we cannot cure the patient. This is actually the essence of the aphorism 3 indicates. The physician is having the knowledge of disease, is having that knowledge of indication, knowledge of medicine power, choice of the remedy, the medicinal indicated, the proper dose. And I explain in every lecture of mine the what is actual the proper dose from Dr. Samuel Hahnemann. Many of these in every seminar, 99% are not aware about the proper dose. That I will explain in my cases also, but you should understand about the proper dose. And now, listen the next line. If you are having, you clearly perceive the patient, you have knowledge of disease, you have knowledge of medicine power, you give the proper dose, and you are aware how to remove the obstacles, then still restoration may be permanent. He clearly wrote, restoration may be permanent. It means that cure is always not possible. So we have to learn about this aphorism into the organ, and please clearly write each and every word. Either it is a small word or a large word. Every word is having their own meaning. So this is from my side for today's organ lecture. So I think you understand. And in my lecture, everyone should be coming with this definition of this symbol. Why Dr. Hahnemann sir choose this symbol? Why he is not choosing the hashtag? Why he is not choosing the @ and the or the star? Dr. Shilpi Arora, please continue.
Thank you, Dr. Shweta, for such a wonderful session. You have made Organon look very easy and simple to us. And we always, means, in fact, when I was in college, I usually has to have little aversion towards Organon, but you really made it very interesting and very knowledgeable. And thank you. Thanks a lot for your time, for your efforts, which you have put in explaining everything. I hope everyone would have benefited from today's lecture. If again, I'll repeat, if you have any doubts, any queries, please put it into the chat box or send it on the website. Tomorrow we'll be having a few medicine discussion, comparative study about few medicines based on those medicines which are very commonly indicated in the acute and chronic conditions of PCOS. So don't miss it. It will be by Dr. Ashish Goyal and same time, 9 o'clock. So I'll be seeing you all tomorrow. Have a very good evening. Thank you, everyone.
Thank you.
Thank you, everyone.
Thank you.